today?
Good, how are you?
Good. My name is Mackenzie. I'm going to be the nurse practitioner completing your physical assessment and just ask you a bunch of questions today.
It's good to meet you.
Perfect. Nice to meet you. Can I have your first name?
Anthony.
Awesome. And your date of birth?
3/15/91.
Sounds great. For the purpose of this interview, I am going to assess a 34-year-old Caucasian male. And why are you here today?
For an annual checkup.
Sounds good. Before we begin, again, I'm going to ask you a series of questions, do a physical exam. If at any point you're uncomfortable, just let me know and we can move forward from there.
Okay.
So how do you think your health is at this current state?
I think it's good.
Good? Okay.
Mm-hmm.
Have you had any health issues in the past?
No.
No? Okay. What do you do for health maintenance, like exercise, dieting? What do you do for that kind of stuff?
Yeah, I mean, I try to take care of myself. I don't work out every day, but, several days out of the month, I'll work out. Some months more than others, but
Sure.
I try to eat healthy as well.
Okay, great. Veggies, fruits, fiber intake, water, drinking enough water.
Try.
Okay. And what kind of exercise do you do if you do exercise?
Run or lift weights, depends.
Okay, so some cardio and then muscle strength.
Mm-hmm.
Okay, good. And how about any stressors in your life currently?
Work's always a stressor.
Sure. Okay, what do you do to cope with that?
Usually try to exercise. I'm a big hands-on guy, so I try to work on things and be by myself sometimes and just, listen to music.
Okay, what kind of things do you work on?
Currently, my house, just renovating the house.
Okay.
So that's been keeping me busy.
That sounds like it. That's a busy thing.
Mm-hmm.
Okay, and I'm gonna just ask you some questions about your past health history. Do you have any allergies, dust, like pets, medications, environmental allergies?
I think as a kid I was allergic to penicillin, and sometimes in the spring, pollen. I take like Zyrtec or stuff, but only when it really affects me.
Okay, so for springtime allergies, so just over-the-counter medications, you were never prescribed anything?
No.
Okay, and in terms of your allergy to penicillin, what was your reaction? Do you remember?
I was a kid, I don't know.
Okay, all right. I'm sure that's something you can find in your chart, no problem. Any health issues as a child? No. Did you ever get the chicken pox?
Not that I remember.
That you remember? Okay. Do you remember, or do you know if you've gotten all of your childhood vaccinations, like your immunizations, up to date with all that stuff?
Yes.
Okay. Even currently, up to date with all your immunizations?
Mm-hmm.
Okay, sounds good. Okay, so allergies, that. Have you, and again, you mentioned no chronic illnesses, nothing right now, pretty healthy guy?
Yes.
Okay, great. Okay, what else? I guess we'll move forward to your family history. And this is just gonna pertain to like your immediate family, unless your grandparents had any like concerning health issues or anything like that. But actually, how many siblings do you have, if any?
One brother.
Okay, and how is his health?
Good.
Okay, and your parents, like any hypertension, diabetes, anything like that?
My father passed when I was younger.
Okay.
I think he had high blood pressure.
Okay.
And I think he passed away from cancer as well.
Okay. Do you know what type of cancer?
No, I was young.
Yeah. Okay.
Yeah. I'm not sure. It might have been like liver or esophageal.
Sure. Okay. Well, I'm sorry to hear that.
Sure.
And how about your mother?
She seems to be in good health.
Good health? Okay. All right. Very well. All right. And then we're going to go to just your psychosocial history. So current living state, where do you live currently? In a home, apartment?
In a home.
Okay. Do you feel safe at home?
Yes.
All right. Who do you live with at home?
My son and my wife.
Perfect.
And 2 dogs.
And 2 dogs. Very busy. Do you have any issues or concerns about when your next know, might be finances with bills, anything like that, any concerns or issues?
No, pretty stable.
Okay, great. And then, do you drink alcohol? Do you smoke cigarettes?
I drink alcohol occasionally.
Occasionally? Okay, like in social situations or out when you're with friends or family?
Yeah, it depends. I don't overdrink. I'll have maybe a couple beers on the weekend.
Okay,
I don't really drink during the week.
okay, yeah, okay. And what do you do for work?
I'm a police officer.
Okay, so that can be stressful at times too.
Mhm.
Okay, and kind of circling back, you exercise, you said you like to work on things to kind of help with those work stressors as well?
Yes.
Okay, very well. And you have a good support system?
Yep.
Family, friends?
Mhm.
Okay, great. So then I guess if you don't have any questions about any of that, we'll move forward with the physical exam. Do you have any questions before we move forward?
No.
No? Okay. And again, for the purpose of the interview, we will just assume the patient has just a gown on, is appropriately dressed moving forward. So what I'm going to do a set of vitals. I'm going to get your weight, height, and then I'm just going to go head to toe. All right?
Okay.
All right. So I will first, actually, can you state your height?
About 5'10".
Okay. And your current weight?
About 200.
Okay. Very well. All right. I'm just going to have you uncross your legs as well. All right. And again, you don't have any history of high blood pressure, nothing like that in the past?
No.
Okay. That's good. Perfect. Do you know what your blood pressure normally is?
No.
No. All right, so you're 135 over 88.
Is that good?
Okay, that's perfect. All right, I'm just gonna check your oxygen and your heart rate here. Stick your finger in. Yeah, thermometer. All right, so your oxygen is 98 and your heart rate is 60. All normal. Did you say you used to run?
Yeah, I run occasionally.
Okay.
And I ran in high school and college too.
Okay. All right. So cardiac wise, you're in pretty good shape. All right. I'm gonna have you just look straight. All right. 98.8. All right. Perfect. Vitals look great. Put this back. Alrighty, so we're gonna start with the head, go down. Alrighty, so I'm gonna actually inspect your hair, nails, and your skin. Any open areas that you know of, any wounds?
I do have cuts.
Okay, nothing, they're pretty much healed over, nothing of concern to you right now?
Nothing of concern.
Okay, alright. Hair looks good, no balding. Gonna check your nails. Good, clean, no abnormalities, no issues. Good. Alright, I see a good cut on your shin right there.
Yeah.
Yeah, what were we doing with that?
I was cleaning the chicken coop.
That sounds fun.
Mm-hmm.
Sounds like a lot of fun.
Yeah.
Alright. I'm going to now just take a look at your eyes. Alright. So you can look forward
Okay.
and inspect them. drainage, no redness. Sclera is white. That's good. Everything looks good and healthy. Good. Okay. All right. And then I'm going to just kind of inspect your sinuses a little bit while I'm up here. Any pain, pressure at all?
No.
No. All right. Okay. Good. All right. I'm just gonna take a look just outside of your ear. Looks good. Take a look over here. Looks good. I'm just gonna take a look inside. Any issues with hearing at all?
No.
No. Okay. Great. Good. No wax buildup. No redness. No foreign objects, which is good. Shut this ear. All right. Same thing. No redness. No swelling. No foreign objects or wax buildup. Okay. Good. All right. While I have my flashlight out, I'm just gonna take a quick look at your eyes, okay? I'm just gonna look at your pupils just to make sure that they are reactive to light.
Okay.
Any issues with vision?
No.
No, okay. Just look straight at me. Okay, just do it quick, and I apologize, I know it's bright. Wonderful.
It is bright.
Okay, but both pupils are reactive. Oops, to light. Brisk, equal, round, so that's good. All right. So next I'm gonna take a look at your nose, nasal passage for you as well. Actually, I may look up there too with a flashlight. Any issues breathing, anything like that?
No.
All right. Again, I apologize. I'm just gonna kind of block your eyes here. Good. Again, no swelling, redness. Everything looks good in there. All right, mouth, good. Can you smile for me? Good. Open your mouth wide. Kind of stick your tongue out. Can you go ah? Perfect. I'm gonna look inside. Good. No lesions. Again, redness. Uvula is intact. Can you put your tongue to one side? And then tongue to the other side. Can you lift it up? Good. Okay. Great. Okay. Good. Perfect. So I'm going just to touch your neck, assess your lymph nodes, thyroid, trachea. Don't notice any prominent lymph nodes. Can you swallow for me? Perfect. Trachea's midline. Good. Thyroid. Again, no swelling. Nodules. Good. Can you turn your head to the left for me? Great. Turn your head to the right. Perfect. I'm gonna just go back to your eyes and then test your visual acuity.
I do wear glasses at nighttime.
At nighttime.
Mm-hmm.
For driving or just
Mostly for work.
for work? Okay. All right. Are you nearsighted, farsighted?
I have trouble seeing distance.
Okay. And how long have you had glasses for?
Since I started work, so 2015, 10 years.
Okay. When was your last eye exam?
A couple of years ago, I think.
Okay. And actually, speaking of which, when was your last physical exam?
This year.
This year? Okay. So within 2025?
Yeah.
Okay. Great. So you're up to date with your normal.
We do it through work, so it's every year.
Great. Okay. So you're doubling up there.
Yep.
Perfect. All right. So this is the Snelling test. So I'm gonna have you close or cover one eye, either or. You're gonna have to cover both at one point. Perfect. And then I'm gonna have you read top to bottom, and then just stop when you get through that difficulty.
From the top, E F P T O Z L P E D P E C F D FELOPZD.
Perfect. I'm gonna have you do it same thing, just with, yep, covering that eye. Apologize.
EFP, TOZ, LPED, PECFELOPZD.
Great. Perfect. Seems like you have 20/20 to me.
Very good.
And then actually I'm gonna use this pen here. I'm also just gonna do a couple other assessments, okay? Just with your eyes. So you're gonna look straight at me, and I'm just gonna have you follow this pen, okay?
Mm-hmm.
Try not to turn your head. Good. Eye movements are smooth. Good. Perfect. Okay, good. And then, so we did your head, eyes, nose, mouth, ears, neck, throat. So we're going to move on to, I'm gonna listen and inspect your lungs now, okay?
Mm-hmm.
Again, no lumps, nothing, no, okay. Good, you said no issues breathing.
Mm-hmm.
Alright, just gonna palpate. Alright, just gonna take a listen. Any prior surgeries?
No.
No. Any hospitalizations, anything like that?
No, I'm trying to think. I don't think anything. I mean, I've broken fingers and stuff, but I don't think there's been anything.
You've never been like
Major.
admitted into the hospital for like an overnight or a
No.
few days? Okay.
No.
Wisdom teeth, that's usually a common one.
Yeah, I had those removed.
Okay. Alright. Again, take a deep breath. Good. Moving on to the back, same thing. Couple more. Good. Lungs sound great, clear. Sound great. I'm gonna then just assess your heart, and then one of the things typically we like to look at is your precordium. So it just kind of helps us give like a little bit of a, I guess, outside picture of your heart. Where to find it, it's like the fifth intercostal space of the mid-clavicular line, and then we kind of just look for if we can visually see it like thumping, or usually if there's anything abnormal, you can kind of like see it through your chest. So we're gonna just take, actually, let me do this, let me locate it first. So we typically inspect it and then kind of palpate it for any like thrills or anything like that. And you mentioned no cardiac history. Alright, I'm gonna again inspect with the light. Okay. Don't know any visuals of any again like thumping or anything like that, so that's good. I'm gonna take a listen. Okay, you can breathe normal. Good. And I'm also gonna take a listen just to your carotids here too. Right, good S1 and S2. No murmurs, that's good. Good rate and rhythm. Strong pulses, perfect. I'm next going to assess your abdomen. So if you don't mind laying back, what I'm gonna do, I'm just gonna inspect it first, and then I'm gonna do some light, medium, and deep palpating, just to kind of feel some for like the inner structures, like your liver and things like that. I'll palpate it, and then on the back too, we like to palpate to just kind of check for any kidney tenderness if you have anything like that. So if you want, you can lay back quick for me. Again, taking a peek. Perfect. If you want to put your hands at your sides, good. All right. All right, I'm just gonna do some light. If it's uncomfortable, just let me know. Soft, not firm. I'm gonna go medium. All right, go deep. Deliver. Any pain at all?
No.
Okay, good. Well, I have you there. I'm just gonna take a listen. Okay, I'm gonna palpate first, but. Okay, good. Good active bowel sounds in all 4 quadrants. Any history of hernias?
No.
What I'm gonna have you do is I'm gonna have you keep your neck like that. Actually, kind of lift your neck and kind of cough. Again. Good. Okay, you can sit up for me, please. All right, and then I'm just gonna palpate back here. If you have any tenderness, let me know. Good. All right, any pain, discomfort?
No.
Okay. All right, sounds good. All right, then moving on. I'm just gonna assess your musculoskeletal system. So any weakness on either side, arms, legs, anything like that that you've noted?
No.
Okay, I'm gonna have you squeeze my fingers as hard as you can. Great, perfect. Say 5 out of 5 strength. I'm gonna have you kind of lift your arms up against mine, kind of like resist, yep. Perfect, same thing, kind of push in, out. Good, and I'm gonna have you push down too. Good, okay. Same thing with your legs. So I'm gonna have you, gonna kind of push against, resist. Good, back. Good. I'm gonna have you stand up. Perfect. Good. Just gonna assess for symmetry. Any issues with your mobility? Anything like that?
No.
Okay. Are you able to bend down and touch your toes?
Mhm.
Okay. Can you show me, please?
Sure.
Good. Okay. Great. I'm gonna have you sit back down. And I'm just gonna check your biceps. Any pain at all?
No.
Check your joints. No pain, nothing. good so far. And I'm gonna check just your neurological system. So one of the things that we like to do sometimes is it's called light touch sensation. So I'm gonna have you close your eyes, and then I'm gonna just lightly touch a part of your body, and then I'm gonna have you open your eyes and point to where you think I touched you. Okay.
Okay.
All right. So we're gonna close your eyes. Okay. All right. Can you tell me or point to where you think I? Perfect. Okay. We're gonna do one more time. Okay. Good. Once more. Good. Okay. Perfect. We did some of like the grip strength and all that stuff. I'm gonna check just your reflexes.
Okay.
All right. Good. All right. So we like to do bicep, tricep, your patellar, okay, and your Achilles. I'm just gonna pretend that I have the correct tool here. All right. Alrighty. Even if I have the correct tool, you like.
Mm-hmm.
Alright, your Achilles. Okay. And then also, I'm also going to assess just your pulses, those that I haven't checked yet. So I did your carotids. I checked just your, I already did your apical, next into your heart. Okay, good. Good. Strong, 2+ so far. I'm just gonna assess here. Any numbness, tingling anywhere?
No.
Alright, good strong pulses. And one last thing I'm gonna check for your neuro exam. I'm gonna have you stand up.
Okay.
Just kind of have you stand straight, arms at your sides. Alright, I'll have you stand like that for a few seconds. And then when I tell you, you're gonna close your eyes for a few seconds. And this is just gonna assess if you kind of start to drift. Gonna test your balance.
Mhm.
Okay. Alright. So you can go ahead and close your eyes. Good. Patient isn't swaying anywhere. Great. I'm going to have you open your eyes. You lift your arms up like this. Yep. A little bit straighter. Perfect. Now you close your eyes. Great. Okay. No drift. Everything seems to be intact. All right. You can open your eyes. Lift your hands down by your sides. Great. I'm trying to think if there's anything else that I need to assess. Everything looks good so far. Do you have any questions about anything?
No.
No? I think that concludes our assessment for today.
Great.
All right, everything looks great.
Thank you very much.
Thank you.